Hi everybody, this is Dr. Y. I'm a behavioral health doctor and licensed clinician, and I'm back today to dispel some myths and give you some tips on how to handle narcissistic personality disorder. This has become another pop culture term, how to deal with a narcissist, all over social media. And I think it's important for us to educate ourselves about different mental health disorders. This is why I do this channel, so that you can have truthful information about the mental health and addiction topics that are related to you, that are important to you. But I feel like there's some untrue information out there, frankly, untrue information about narcissistic personality disorder. And for this video, I'm going to call it NPD. So let me share some factual information with you first about NPD that comes directly from the DSM-5. That's my mental health Bible, folks, the Diagnostic and Statistical Manual. Okay, so there are some things that we know about narcissistic personality disorder. The first thing I want to say is people are not disorders. We have to be really careful about labeling people's character and who they are, their identity as a person, as a mental health disorder. This can contribute to why people don't want to talk about mental health, and they certainly don't want to go around telling other people that they have a mental health diagnosis because of the stigma and the judgment that can come from that. People are people. The disorder or the diagnosis is a disorder or diagnosis. That's it. Okay, so NPD we typically see more often in males than females. The definition of NPD really comprises a couple of different factors. One is that there is this persistent need for grandiosity. That means you're the coolest duck in the room. That's what that means. You're the best. You're the brightest, you're the most brilliant, you're the smartest, and everybody else is inferior to you. Admiration, accolades, value-based comments from other people. You are attention-seeking, all of that admiration in order to feed your ego. Along with the lack of empathy, which means you have zero concern about the thoughts, feelings, or condition of other people around you. These are hallmarks of narcissistic personality disorder. A lot of times what we see is that it starts in early childhood and occurs in a range of situations. So I'm going to go through the 9 DSM-5 criteria for NPD. When a patient comes in for a diagnosis, they really only have to have 5 out of the 9, in addition to some other factors, to qualify for a possible diagnosis of NPD. Here we go. One of those characteristics or those criteria are this grandiose logic of self-importance. They have created a whole narration about their self-importance. It is crucial to their ego to feel, and their sense of self-worth and self-legitimacy, to feel that they are important. And not just that they feel that they're important, but that other people recognize and tell them that often. The next one is a fixation with fantasies. A lot of times with different personality disorders, we see that people who have this diagnosis may be living in their own reality that's made up by them. This fantastical world that they're living in really is built around infinite success, control, brilliance, beauty, or even idyllic love. The next one is a belief or a credence. So this is kind of like it's their motto that he or she is extraordinary and exceptional and can only be understood by other people that are extraordinary or exceptional. And this can be people or institutions. The next one is a desire for unwarranted admiration. So what that means is they didn't do anything to get accolades or admiration from other people. They just feel like they're owed that admiration. Next is a sense of entitlement. They are owed whatever they want from whoever they deem appropriate. An interpersonally oppressive behavior. So that means within the function of their close relationships, they are oppressive to other people. They are projecting on them their own values, their own thoughts, their own needs, without any thought of what the other person may need. There can be a resentment of others or a conviction that others are resentful of him or her. So resentment is feeling like you lack something, that something should have been yours when it wasn't. So it kind of plays into that entitlement feature. And the last one I want to share is there's a display of egotistical and conceited behaviors or attitudes chronically. So this is a pattern. It is a behavioral way of life. There are no changes or even adjustments that are made. They do not believe that they need to make anything change. Now, while there aren't any physical characteristics associated with NPD, one thing that we do see in the behavioral health world is that there are a lot of co-occurring disorders that pop up with this diagnosis. So a co-occurring disorder or a comorbid, you may have heard that word too, disorder means that you have two disorders that are functioning at the same time. Let me share with you some information about some co-occurring situations or diagnoses that can happen with NPD. The most common is major depressive disorder. We see MDD, major depressive disorder, show up 45 or 50% of the time with clients with NPD. Bipolar disorder presents 5 to 11% of the time. On the other hand, the most prominent and prevalent comorbid diagnosis that happens with NPD, and this happens 24 to 62% of the time, is substance use disorder. So what that may mean is that for the mood disorder portion of the presentation that this particular patient may be experiencing, they are trying to self-medicate that. Treatments for NPD are pretty straightforward. A clinician may work with an NPD patient using cognitive behavioral therapy and working on thoughts, behaviors, and thinking patterns. Okay, now you know the goods on NPD. You know the DSM-5 diagnosis definition, you know a little bit about co-occurring disorders, you know a little bit about treatment, and now I'm going to share with you how to deal with a patient who has NPD. Look, this can be really difficult because when we're talking about personality disorders, we're talking about a condition that is not curable. Now, even though it's not curable, it can be manageable. And yes, I do believe that people with NPD, if they desire, can change. They can change some of those core beliefs. They can change and work with a professional on how to change their behavior. But when we're talking about how to deal with that, because it can be very difficult for loved ones or significant others or even children to deal with that kind of personality disorder, here are some things that I want you to consider. Here are 7 tips. Number 1, you need to educate yourself about NPD. So you can listen to this video, but I would advise you Google DSM-5, Narcissistic Personality Disorder, and see what comes up. You yourself, as a loved one, as a significant other, need to know what you're dealing with, what you're up against, and what your loved one is experiencing. Number 2, you need to protect your own self-worth and self-efficacy. It is not okay for you to have to sacrifice who you are, your mental health, your physical health, because of somebody else's mental health disorder. Not okay. So what that means is that you're going to have to practice self-care and maybe even seek professional help in order to understand what you can do to balance the situation. Number 3, I want you to consider speaking up for yourself. You are your best advocate, and it is not okay to be stepped all over just because your loved one has NPD. You have the right to stand up and say, this isn't acceptable. I don't want to do this anymore. Maybe you should check out my other videos on boundaries. They give you suggestions on how to say it and the different areas of boundaries that can be helpful when you're trying to formulate thoughts about where to start. Number 4, Learn and practice calming skills. A lot of times I hear from family members that NPD patients can be very infuriating because when they're trying to work through problems or they're trying to point out things that they need, their needs go unmet. So practice your own calming skills. Learn these tools to help de-escalate situations that can get heated. Number 5, I want you to create a support system. This is really a tough situation. It can be. And so going it alone is not a good choice. If you can, build a network of friends and family and people that you trust and care about to support you while you're trying to support them. Number 6, I want you to insist on action. One of the things that happens with an NPD patient is part of the fantasy and part of that illogical grandiosity can mean that they can talk a lot, make promises that they don't keep, say things that they don't mean. They can be very charismatic. They can be very believable. But what I'm telling you is you need to insist on action. If they're not willing to act instead of just talk, then you're going to have some decisions to make. Number 7, I want you to be doing an assessment always, constantly, on your medical and psychological welfare and needs. And you're going to have to recognize when enough is enough. There may become a time where you just have decided that it isn't worth it for you anymore and that you can't heal in this kind of environment. And if that is the case, that's okay. In other situations, I've seen people get into professional help and they've been able to work through some of the pitfalls in their relationship. Either way is fine, but each person deserves the ability to be healthy in their own right. NPD can be a very tough diagnosis for the patient and the family. I'm going to put together a few other videos around this type of behavior disorder so that you can have more information and know exactly what you need to do. Don't forget, like and subscribe to my channel. I can't wait to hear from you.